Hi, and welcome to June 2026 Medicare Minute. This week, we are going to be discussing original Medicare and Medicare Advantage appeals. If you were denied coverage or authorization for a health service or item, you may appeal the decision. So let's talk about how you can do this. First, it's important to understand what a Medicare appeal is. A Medicare appeal is a formal request to review a decision made by Original Medicare, a Medicare Advantage plan, or a prescription drug plan. It's important to note that a Medicare appeal is different than a grievance. A grievance is a form of complaint that you file with your plan about the plan's action. This could be like that they didn't give enough notice, that they were changing something, or that maybe when you spoke to an agent with that plan provider, they were really rude. So you could call and leave a grievance or a complaint about that. So it's important to know that there's a difference between a grievance and an appeal. An appeal is something that you can apply for when you are having a problem with getting your care. So what do you do if a health service or item is denied? You firstly should read all the letters and notices sent by Medicare or your Medicare Advantage plan. You can call your Medicare provider or MA plan to learn why they're denying the coverage. You can strengthen your appeal by including a letter of support from your doctor, and then continue to the next level of appeals if you are not successful at the first level. File each appeal in a timely manner, and that's really quite important because the timeline is very significant, or your appeal may not be considered. If you can't submit your appeal within a time frame due to being in the hospital or some other reason, you may be eligible for a good cause extension. So we're going to dive into original Medicare appeals now, and then later we're going to look into what to do when you have a Medicare Advantage plans. So filing an original Medicare appeal to find out if your original Medicare has covered or denied your health care services, it's important to check your Medicare summary notices. These notices are coming out to you in the mail once every 6 months, so biannually. So you want to check your MSN, and it will tell you if Medicare did not pay for a service and that what you should do next, which is located on the back of the MSN. So the instructions would be like, call your doctor before appealing to make sure that there wasn't a billing error, which happens sometimes. You can start your appeal by following the appeal instructions listed on your MSN and send your appeal to Medicare Administrative Contractor, MAC, within 120 days. MAC's name and address are listed on the MSN just for you to know, and they should come to a decision within 60 days. If your appeal is successful, your service or item will be covered, and if your appeal is denied, you can move on to the next level of appeals. So one thing you may not have known is that there are 5 levels of appeals. So the first one is going through the MAC. Next is going through the Qualified Independent Contractor. After that, it's the Office of Medicare Hearing and Appeals, Medicare Appeals Council, and then, of course, lastly, Federal District Court. So you could move through all 5 of those appeal processes. Now, let's talk about Medicare Advantage appeals, which are slightly different than original Medicare. The MA pre-service appeal, so if your plan denies coverage or authorization for a health service or item before you receive it, you can appeal to ask the plan to reconsider their decision. Start your appeal by following the instructions on the notice of denial of medical coverage. This gets sent to you in the mail. File your appeal within 60 days, there's another date to note, of the date of the notice. Send a letter to your plan explaining why you need the service or item. They should come up with a decision within 30 days. Now, let's say you've already had the service and your Medicare Advantage plan decides to deny your service that you've already had. These are the steps you want to do for that. If your MA plan denies the service or items after you receive it, you should receive a written notice from your plan. This can either be an explanation of benefits, an EOB, or a notice of denial of payment. These are not bills, just to let you know. Start your appeal by following the instructions on the notice. File the appeal within 60 days of the date on the notice. The plan will make a decision within 60 days. These are the 5 levels of Medicare Advantage appeals, which you will see are different than that of original Medicare appeals. You firstly have the redetermination, the independent review entity, the Office of Medicare Hearing and Appeals, Medicare Appeals Council, and then, again, the Federal District Court. So let's get some practice. Let's see if you can determine if this individual could apply for an appeal or if they should maybe not. Example 1. Paula received a Medicare summary notice showing Medicare did not pay for a recent blood test. Paula is confused by Medicare's denial. She was told lab tests are covered under Part B, and her doctor told her to get the test. Can Paula appeal this? And what are her next steps? Well, here's your answer. Yes, Paula can appeal a Medicare's decision to not pay for the blood test. Paula should call her doctor before appealing to make sure that there was no billing error. She can start the appeal by following the appeal instructions listed on her MSN and send her appeal to Medicare Administrator Contractor, the MAC, within 120 days. She should include a letter from the doctor explaining why the blood test is medically necessary. If her appeal is successful, the blood test will be covered, and if her appeal is denied, she can move to the next level, the QIC. Here's our next example. Jim is enrolled in a Medicare Advantage plan. He needs routine vision checkups, and when enrolling, a plan representative promised that the plan will cover the annual vision visit. Jim was recently denied coverage for an annual vision visit. Jim appealed directly with the plan, and the plan upheld the denial. Can Jim continue to escalate the appeal? And if so, what are his next steps? Well, here's the answer. Jim, of course, can escalate the appeal. In Jim's case, his plan should automatically forward his appeal to the Independent Review Entity, IRE. Jim does not need to file a new appeal for this step. The IRE will review the case independently of the plan. If his appeal is successful, the visit will be covered, and if his appeal is denied, he can move on to the next level, OMHA. This is our last example. Jacob has original Medicare, and his doctor prescribed him a vitamin D. His standalone Part D plan denied coverage, and Jacob appealed at the first 2 levels. He has now escalated his appeal to the OMHA level and is waiting on a decision. He was told his appeal was denied because Medicare does not cover prescription vitamins and minerals, even if prescribed by a doctor. Should Jacob continue to appeal? Well, here's the answer. Jacob can continue his appeal, but since prescription vitamins are excluded from coverage under Medicare's law, he is unlikely to succeed if he continues to appeal. Alternatively, Jacob should speak to his doctor to see if the over-counter vitamins are a possibility. He should also contact his state health insurance assistance program to see if his state has a state pharmaceutical assistance program that he may qualify for. Depending on the SPAP, it might help with covering the cost of his vitamins. So let's say you are facing an appeal. What are you going to do? Well, first, take action. Contact Medicare or your Medicare Advantage plan for more information regarding your denial. Contact health coverage provider to request a letter from your doctor in support of your appeal. And then, of course, contact the state Health Insurance Assistance Program for counseling around appeals. Thank you so much for joining us this month, June, for our talk. And if you need us for anything, we are here to support you to give non-biased counseling on your Medicare issues or needs. Please give us a call at 410-887-2059. We'll see you next month.